Okay, thank you. Good morning, everyone. I'm sure we'll have a few more people join us along the way, but I thought we would just get started. My name is Judy Shaw, and I'm the Chief of the Appeals Unit for the Maine Paid Family Medical Leave Program. Our unit handles applications for private plan substitutions as well as appeals. The focus of today's webinar is to provide information, especially for insurance producers, brokers, and consultants, so you can assist us in helping your employer clients have a smooth private plan application process and maintain a compliant private plan going forward. So this is an opportunity we're hoping to be able to sort of join forces to help make these processes move as smoothly and efficiently as possible. We're going to ask today, if you have any questions, to please put your questions in the chat. My colleague, Sophia Khalid, is here with me, and she's going to be monitoring the chat and giving me your questions to answer. There will be a big chunk of time to answer questions at the end of the presentation, so I will answer most of the questions at the end, but if Sophia sees something that it would be best to answer right along the way, I'll go ahead and do that. I'm going to be sharing my screen. I do have a PowerPoint that I'm going to be using. The PowerPoint will be posted to our website, and you may have noticed that we are recording this webinar as well. So the webinar will be posted to our website too. So if after the webinar you feel like you had some important, helpful information that you have colleagues or friends, they might benefit from this information, please encourage them to check our website, where they will be able to see the PowerPoint and see the presentation. It's going to feel like there are a lot of slides in this PowerPoint. There are a lot, but I'll move through them relatively quickly, because one of the things that I want to do is to walk through what the process looks like for an employer who is applying for a private plan through their account on the portal. And then I want to talk about some common deficiencies that we see when we review applications, talk about ongoing obligations, which is really important. There's been a little bit of confusion around that as well. So let's get started. Just share my screen here. Show. Stop sharing for a second. 1 second. Go ahead and do it this way. Yeah. And let's try again. And here we go. Great, thank you for your patience. So as I said, our goal today is to provide you with the information that will help you assist employers with their private plan substitution applications. And we also hope that you can use some of this information to help us reinforce the need to comply with certain ongoing obligations, including payment of fees, and filing detailed and complete quarterly wage reports. I'll provide more information on those as we go along, as well as a couple of other obligations. Together, I think that we can provide an efficient and effective private plan process. So the first thing I want to talk about is, how does an employer prepare before they actually submit their private plan application? The first question for an employer to ask, oh, hold on 1 second. let me just go back. Okay, here we go. The first question an employer should ask themselves is whether or not they want to have a fully insured or a self-insured plan. And we, if they want to purchase an approved and certified Maine PFML policy, or do they want to develop their own private plan document for employees? For fully insured plans, the employer will have to either upload a copy of the insurance policy that they purchased, or they would upload an evidence of coverage form. And that form needs to include, at a minimum, the insurer's name, address, and contact person for the insurer, the policy effective date, the initial term, the renewal terms, and certain numbers like the state electronic rate and form filing number, the policy form number, and absolutely must include the policyholder's name and federal employer identification number. There are some insurers that have developed an evidence of coverage form that they provide their brokers to provide to the employer. We have accepted those, and those forms can be uploaded in place of a full insurance policy. Importantly, if the policy covers affiliated or associated companies, those must be listed in the policy or on the evidence of coverage form. We'll talk more about associated companies in a little bit, but what we're talking about is perhaps a policyholder that is the parent company and they want to have subsidiaries or affiliates also covered under the policy. We have allowed that very limited opportunity to include those associated companies. And as you'll see when I start to walk through the application steps, the policy or evidence of coverage form will have to be uploaded during this process. I would ask that you please be clear with the employer about what they need to upload. We have received applications for insurance. We have received offers to provide coverage of insurance. And we've also seen some really great marketing material, but none of that is helpful. We need to have the actual document that proves that an approved and certified Maine paid family medical leave policy has in fact been purchased, what its terms are, when benefits begin, what the renewal terms are, etc. Now, in terms of self-insured plans, the employer needs to take the template plan document we have on our website, and this is all under employer resources, private plans, and create a document specific to their business. That plan document will be uploaded as part of their application. The other two documents they have to upload are the checklist of required terms from our website, and that checklist sets forth the provisions that have to be included in the plan document. The employer on that checklist enters in the last column information about where these requirements are addressed in the plan document by page or section or paragraph. This really streamlines our review of what is a very detailed plan document. And then the last document that the employer will need to upload is the surety bond. And again, I'm going to walk through these steps with some screenshots in just a few minutes. Keep in mind, the amount of the bond has to equal the total wages for the four most recent quarters times the employer's premium contribution rate. So it's either times 0.5% for employers with 15 or fewer employees and 1% for employers with more than 15 employees. I want to talk about the costs for a minute. There's been a lot of confusion about the fact that there are two fees that must be paid when we talk about private plans. The first is the application fee of $250, and that is paid at the time that the application is submitted. And it can be paid through their bank account or can be paid with a credit card, and that's part of the process in the portal. The administrative fee is also $250, and this is assessed when an application is approved and should be paid immediately. The purpose of this administrative fee is to cover the costs of ongoing oversight of approved private plans. So if at all possible, if you're working with employers who have applied for a private plan, then please remind them that they have to pay this second fee in order to keep their plan in compliance and to avoid any adverse consequences at all. I'm going to walk through, there's lots of content on our website, as I mentioned, under employer resources, private plans. And again, this PowerPoint and the video of the webinar will be on our website. What I want to do now is walk through very quickly what the employer sees when they go in to apply on the portal, and the process that they need to follow. And then I'm going to, as I said, talk about some common deficiencies that we see when we've been reviewing applications, because these deficiencies, if they can be corrected right up front, if they come in with a clean application, that can move the review process through much more quickly. I'm going to talk about what that review process looks like and some timelines, and again, talk about ongoing employer obligations. We will also touch on what to do if there are material changes to the plan or if an employer wants to cancel their plan as well. So a couple of things. When an employer is ready to submit a private plan, the first thing is, have they registered in the portal? There are still some employers who have employees in the state of Maine that they're paying wages to who haven't registered. So the first question, if you're a broker or producer working with an employer, is just to confirm that they have in fact registered and they have an account in the paid leave portal. If they're already registered, their first step would be to log into their account. And this will bring them to, as soon as they log in, it brings them to a summary page, which hopefully they're already familiar with. On this screenshot, we show that when you get to the summary page, if you click on more, that is what the employer wants to do for private plans. So when they click on more, as you'll see below that blue line, there is a panel for private plans. And if they do not currently have an approved private plan, they would click on request substitution of a private plan. Once they do that, they're going to be brought to this information page. I know personally, if I was trying to complete a process and came to an information page, I'd want to just scan it quickly and move along. But it is important that the employer spend just a little bit of time taking a look at this page. It reminds us of lots of important information, reminds us that if the application is approved, that only means that the employer is exempt from paying premiums into the Maine Paid Leave Fund, but they're still required to file quarterly wage reports and detailed and timely wage reports and the annual data report showing the claims results of the private plan. And we'll talk about both of those later. For the fully insured, you can see that they will need some basic information about the insurer and the policy, as well as some form of evidence of coverage, which again could be the insurance policy or an evidence of coverage form that includes all of the key information I mentioned previously. We remind them here again that there are two fees. There is the $250 application fee, and we're reminded that there will be an additional $250 administrative fee if the application is approved. So hopefully the employer will look at that information, take it in, and then they would be able to click next, which will bring us to our next screen. This screen is also very important. These are the attestations. These attestations give us here at the department assurances that important requirements are being met and will continue to be met as long as the private plan is in effect. The employer needs to carefully review each of these attestations, and in order to move forward, they will need to check the box next to the attestation. Then they would click next. Now, please note at the bottom left that if an employer should get interrupted while they're completing their private plan application, they can save a draft and come back to it later and complete it. The key will be to remember to come back. I would probably forget to come back after I've saved the draft. So they need to remember to come back and complete and submit the application. But again, reviewing these attestations very carefully and making sure they understand them before they check that box is important, but they will need to be able to legitimately check each of those boxes before moving the application forward. The next key question is what type of plan? For our purposes, right now we're talking about fully insured plans. So we would click fully insured and then we would click the next button. Then this brings us to the fully insured private plan details. Now here, we would start with the insurance carrier. We would click the down arrow, which is going to give us a list of the 20 insurance carriers that have approved and certified plans in Maine, and we would select the carrier we bought the policy from. By selecting the carrier, you'll see the next box is your plan number. The system automatically populates that box. So if I were to select ABC carrier, the plan number that is associated with that carrier will automatically be populated. This is not the insurance policy number. It's the state electronic rate and form filing or SERF number. And that's why we go ahead and auto-populate it, because an employer is not necessarily going to know that number. This can be confusing, but what's most important to remember is just that the system is going to enter that number. It's not the employer. The employer sometimes will get confused and say, this isn't correct, that's not the right plan number. They really just need to pick their insurance carrier and then move forward to the benefit begin date. So if that's something you could help reinforce, that would be helpful for us, and of course, helpful for the employer. The benefit begin date is an important date. This is the date when the employer's plan will begin to provide benefits to their employees. This date cannot be any later than May 1st, 2026, which is the date that the state PFML fund will begin paying benefits. But the employer could choose to start providing benefits sooner, and we do have a few employers who have chosen to do that. Once we get beyond May 1st, 2026, the rule says that the benefit begin date will automatically be the first day of the month following approval of the private plan substitution. So for now, it's important that that benefit begin date match whatever the effective date of coverage is in the insurance policy. So those two dates should match. If they don't, then the employer is likely to get a call from a reviewer just confirming which date is the correct date. And so after we've completed that, we hit next and we get to required attachments. And this is where the employer is going to upload a document that actually shows that they have coverage under an approved and certified Maine PFML policy. This is done by uploading, again, either the insurance policy or a portion of the policy that contains all of the required information, or that evidence of coverage form that I've referred to previously that contains the key information I mentioned and in the beginning. So when you know what document you want to add, the employer would click the Add Attachment button. And by doing that, a screen will pop up for the employer to select the file that they want to attach. So first, they would click the down arrow to select the type of file they'll be attaching. Here we're choosing private plan proof of purchase. That's what an employer would want to select if they want to upload an insurance policy. Next, they would click choose file, and this will allow them to search for the document on their computer that provides proof of purchase and evidence of coverage. And so once they choose that document, they would click open and the file will populate in the portal. And I'll just show you an example here. So you can see that I chose my test document for ABCD private plan insurance policy. And so once that file has populated, the employer would click OK. That then brings us back to the required attachment screen. We can see that the attachment uploaded, there are no other attachments required for a fully insured plan. And in the portal, there would be a next button to click to get to the next screen. So let's pretend we hit the next button and it brings us to the review screen. This allows the employer to review the basic information they've submitted to make sure that it's correct. Now, you'll see that I put in a benefit begin date of July 1, 2026, which is after the May 1, 2026 date that benefits begin in the insurance policy I bought. This review would allow me to go back to previous screens and correct that error. So you'll see beside the next button, I could hit previous and I could go back to previous screens and fix that benefit begin date. But for now, we're just going to pretend that the date is correct. The next step is to pay the application fee. And you'll see that again, we are reminding people that the application fee needs to be paid now. But if they're approved, there will be an additional $250 fee covering the work of overseeing private plans. And that includes things like future audits. So here the employer, if everything looks good, would click next, and they would be brought to the payment screen. The employer here would enter a new payment method, or they could select a payment method that they may have set up when they registered in the portal. As I mentioned, there is the option to pay the application fee with a credit card. I set it up to pay through an ACH transfer through a bank. You would simply enter the amount and click next. And now we're at the final step. Here the employer, if they are ready to submit their private plan application, they would include the password that they use to log into their account. And they need to read the certification very carefully to make sure that everything they've entered is accurate and truthful. And then they can click submit. After they click submit, they're going to come to the confirmation page. And this is a page that we're all familiar with whenever we do these types of activities online. So it's important, again, that the employer read the next steps so that they know what to expect. It's also important for employers to remember that all of our communications with the employer are going to be done through the portal. I see a question about whether there are additional processing fees associated with the use of a credit card payment. There are. I apologize that I don't know exactly what they are. 3% is sticking in my head right now, but there are additional processing fees associated with the use of a credit card payment. So communications are going to be through the portal, and it's especially important to please remind employers they should be checking their account in their portal on a regular basis. My personal opinion is if you have submitted a private plan application, the employer should be checking that portal, just check on it every day, because these applications can move forward much faster if they see a communication from us quickly and we're asking a question and they respond quickly. The faster they respond to our inquiries, the faster we can complete our review and any deficiencies can be corrected. And so also reminding employers that if their application is approved, this only exempts them from the premium contribution obligation, not ongoing wage reporting and annual claims data reporting obligations. So that completes the process for an employer to apply for a fully insured plan. I wanted, for fully insured plans, just talk about some of the common deficiencies that we see. And this is where you can be especially helpful if you're an insurance professional helping employers file their private plan applications, because a clean application can be reviewed and approved relatively quickly. Some of the deficiencies we see is, instead of uploading an approved main PFML policy, an employer might upload a short-term or long-term disability policy. Those policies don't qualify for PFML coverage. We have seen employers also upload PFML policies from other states, Massachusetts in particular, sometimes employers will inadvertently upload their Massachusetts policy instead of the Maine policy. So making sure that they're uploading the correct documents. And as I mentioned, applications for insurance, marketing materials, all kinds of things get uploaded simply because the employer maybe doesn't fully understand exactly what document. So the more you can say, this is the particular document you need to upload, the better off will be. Uploading incomplete documents is also going to slow the process down, and this is a very common deficiency. We have seen evidence of coverage that does not include the name of the policy holder. It doesn't include the policyholder's FEIN, which needs to be provided so that we can make sure that we are approving a private plan for the same employer that is in the portal. Or not including or putting in an incorrect benefit begin date. I want to talk about associated companies a little bit and what that means. So insurance policy, PFML insurance policies cannot be written for association groups, multiple employer welfare arrangement, any type of professional association. The only time anybody can be covered under a PFML policy in Maine, other than the policyholder, is when the policyholder has some significant corporate relationship with those associated companies. And we define that significant corporate relationship as one of three things. If the policyholder is a parent company or a holding company, and they want that policy to cover other associated companies, those associated companies need to be either a subsidiary or an affiliate of that policyholder. If the associated company is not a subsidiary or affiliate, because that's simply not the corporate organizational structure that is used, then the policyholder must have majority ownership of the associated companies. So I think about if I owned a landscaping company, but I also own 2 or 3 garden centers to support my landscaping company, but I'm not set up in a corporate structure where those garden centers are affiliates or subsidiaries of my company or a holding company. Rather, I simply have majority ownership in those garden centers. That would be considered a sufficient association to allow those garden centers to also be covered under my PFML policy. But if I do not have majority ownership, whatever my landscaping company or the majority owner in the landscaping company doesn't have majority ownership of those associated companies, it is not going to be permitted. I know that that's complicated. We're trying to work out some more details to be able to provide more guidance. We've had a number of policies written that do not meet these criteria. Make sure you know who that policyholder is. We have had policies, unfortunately, written to entities that could not legitimately hold the policy. So please make sure that you understand and have done some due diligence around who you're selling these policies to. I also want to emphasize that the application will not be able to move forward if the employer is not already in full compliance with their obligations. So if they owe fees to us, if they owe premium contributions from prior quarters prior to submitting the private plan application, if they have failed to file wage reports, so there's 1 or more wage report that's outstanding, that will stop the application from moving forward. So my suggestion for you to consider is before this employer even submits their application, please confirm that there are no other outstanding obligations on the financial side of our house that need to be corrected. And if there are, then help the employer correct them before filing an application. In terms of, we see a question, do the subsidiaries need to be listed in the plan? Yes, any associated companies need to be listed in the policy. And if they're uploading an evidence of coverage form instead of the policy, they need to be listed on the evidence of coverage form. Most of the insurance policies that have been uploaded have a schedule toward the back that lists the associated companies, affiliate subsidiaries, and the like. Those associated companies or subsidiaries, as noted in the question, should not be included on that main paid family medical leave policy unless they have in fact registered in the portal. So they need to register in the portal. They need to submit their own application. And what they would upload is either an evidence of coverage form or an insurance policy that lists that subsidiary as also covered under the policy. We will reach out likely to say, okay, provide us information to establish that there is an association between the policyholder and the associated companies. But to be clear, using my example, my landscaping company and all of the garden centers would be, assuming we have employees working in Maine, we would all need to be registered individually based on individual FEINs in the portal. And then if each of those, the landscaping company and each of the garden centers want to be able to have a private plan, we each need to individually apply for our own private plan, but we would all upload that single insurance policy showing landscaping company as policyholder and garden centers as associated companies, including the FEIN for each of those individual entities. So if we can get all of that information on the forms or in the insurance policy, including the FEIN, then the application can move forward a little more quickly. We have a question about employers who are unsure whether they have any outstanding issues before filing. Will they be notified so they can correct? The best way for an employer to know whether or not they're in compliance is to log into their account. They will be able to see when they log into that account, whether they have a $0 balance or whether they have a $5,000 balance. They will be able to click to find out whether or not their wage reports are current. Visiting that portal on a regular basis, at least weekly, my personal opinion is take 15 minutes a day and just log in and take a look to see if there's any new messages, any alerts, any new information. 15 minutes, maybe that's a lot for some businesses, but I think an employer could spare 15 minutes. If they don't see, if they're not sure what they're looking at, they can always call our call center number, and that information will be, my last slide will give all the contact information. So I would just encourage employers to practically, live in the portal. That's where all the information is going to be housed. And then if they don't understand what they're looking at or don't see something, even if they have a payroll processor, if they can access their account, they should look in there as well. But they can always call our call center and get information. Okay, so now I just want to focus on self-insured plans a little bit. A self-insured plan essentially means that the employer is going to implement a PFML plan that is substantially equivalent to the state's PFML program using their own human and financial resources. I personally think of these, what the statute calls self-insured plans, as more self-administered plans. And this is an important decision, and businesses should think about it and consider it very carefully. So here are some questions that I recommend employers ask themselves. Does my business have the financial capacity to pay PFML claims that are made by my employees? There isn't going to be a state fund that is going to be covering these claims. There isn't an insurance policy that's going to cover these claims based upon premiums paid by the employer. The employer needs to have the financial ability to pay the claims as they occur. Does the employer's business have financial resources, human resources, and the administrative infrastructure to oversee the full administration of a private PFML plan? That includes claims review, that includes the ability to handle a reconsideration of the denial of a claim before the employee has the right to appeal to the state. And so it's important that the employer consider that. Now, if the infrastructure doesn't exist, it doesn't mean an employer can't move forward, but then they need to ask themselves, okay, do I have the financial capacity to contract with a third-party administrator to handle those services for me? And then the last question they should ask is there any reason why my business would have difficulty obtaining the required surety bond? So after answering those questions, an employer believes a self-insured private plan is the best option for their business and their employees, they can apply through the portal as well. The application process is very similar to the one for fully insured plans, but there's different information required, different documents that need to be uploaded. For a self-insured private plan, the employer has to create their own private plan document, which is not unlike the insurance policies that have been reviewed, approved, and certified for fully insured plans. And in crafting that plan document, it's important to remember that the plan must be substantially equivalent to the state PFML plan. There cannot be a huge amount of divergence between what the state PFML plan provides, and so there has to be adherence to the existing laws and rules. It's important to track those laws and rules very carefully because any substantial deviation could result in the application being denied. And so this is where using the template plan document on our website can be really helpful, because that plan document lays out all of the requirements in a format that ensures that all of the legal criteria are captured. The employer will also have to purchase a surety bond. There is a surety bond form on our website. That form must be used. As I mentioned, the amount of the bond is equivalent to what the employer would otherwise pay to the state fund over the most recent 4 quarters. So if, for example, if the employer's premium rate is 1% of wages, and the total wages for the most recent 4 quarters is $500,000, the surety bond in that example would be in the amount of $5,000. And as I said, the bond form that must be used, a checklist of what needs to be included in the plan, and a template that employers can use in creating the plan document, along with guides, are all posted on our website under Employer Resources, Private Plans. So let's see how this process works in the portal. I've jumped ahead through some of the screens that we saw previously directly to plan type. And so this is where the employer would select self-insured and then hit next. So now things change up a little bit. This is where an employer indicates whether they will be implementing their plan using their own resources, or if they'll be contracting with a third-party claims administrator. Now, third-party claims administrators must be licensed by the Bureau of Insurance, and they must have been granted health authority by the Bureau of Insurance. I'll note deficiencies in a few minutes, but that licensure and having health authority is an issue that we've seen a few times. So let's just say that the employer is going to contract with an administrator. The next screen that would pop up would ask for who is that plan administrator. This allows us to run a search through the Bureau of Insurance website to make sure that that plan administrator is licensed with the proper health authority. They would also indicate the name of the surety bond company who wrote their bond and the bond amount. And then once that information is entered, the next button would appear and the employer would click next. If the employer is not using an administrator, they would click no on the prior screen, and then they would be brought up to this panel, which only asks for the name of the surety bond company and the amount of the bond. And I've entered some information. So once that information is entered, the employer would click next. So now it's time to attach some files that will comprise the documents that will need to be reviewed as part of the application. This is the same process as we discussed for fully insured plans, but the types of documents are different. So I decided not to explain how to add attachments again. I hope that's okay. Instead, I just wanted to explain better the documents that will need to be attached. So first of all, the employer, or if a plan administrator, if they have one, has developed their self-insured private plan document, they will need to develop that document. Again, that document outlines all the processes and procedures for administering the plan, explaining to employees how they apply for benefits, how benefits are calculated, how they're going to reconsider any denials or partial denials of claims for benefits, and any other aspects of the plan that establish that the plan is substantially equivalent to the state plan. As I mentioned, there is a template on our website that can be used, as well as that checklist that outlines what must be included, and that's under employer resources on our website. The checklist has a column to the right where the employer needs to indicate the page in the plan document where that specific requirement is met. So they will have to include all of the definitions from the law and the rule. If there's a definition of covered individual, for example, in that final column, the employer would note where that definition appears in the plan document. It greatly streamlines the review process for us. That checklist gets included as a cover sheet to the plan document. So when I uploaded my test document, included on the first few pages will be that checklist indicating where, it's sort of a roadmap to the underlying plan document, indicating where those requirements appear in that plan document. And then the other document that has to be added is the actual surety bond, which we've already discussed. And once both files are added, the employer would click next. That takes us to that review screen. And then by clicking next, the employer would be brought to the payment screen, which I didn't include, the review screen, the confirmation screens, but they're all the same as they were for fully insured plans. So as with self-insured plans, we do see some common deficiencies that I'd just like to note. Because if these deficiencies are corrected before the application is filed, then we can move our review forward more quickly. So first of all, using the template plan document can really reduce the amount of changes that we need to ask to have made to the plan document. The template can provide a really good roadmap, and when it's used in conjunction with the checklist of requirements, it can limit the number of requests for changes that we make. Completing the checklist by noting where the requirement is met in the proposed plan document is really important. That including that checklist as a cover sheet to the plan document when it's uploaded is really, really important. It can really streamline the process, both on our side and on your side. It's critical to keep in mind that the checklist is the set of requirements. We often see plan documents that leave out definitions, that add new definitions that aren't included in the law and the rule. And sometimes we see plans that exclude certain types of leave. For example, we've seen applications where the plan document excludes bonding leave or it excludes safe leave. That's not permitted. The law has established what constitutes paid family and medical leave. So all forms of leave must be included in that self-insured plan document. I also mentioned here on the screen that sometimes the bond amount is not correct. This is another great role for insurance professionals to assist employers, just help them make sure that that bond amount was calculated correctly. Any deficiencies, either in a fully insured plan or in a self-insured plan, we will send a letter again through the portal. So employers, please make sure that they're checking their portal, but they will receive a letter saying, in order for us to move your application forward, we need you to correct A, B, C, and D. And they'll be given a 10-day time frame to correct those deficiencies. It's important that they try to meet that time frame, but communicate with us if there is a legitimate reason why that time frame can't be met. Communicate with us if there are questions about what we're asking the employer to do to correct deficiencies. It's all about communication. Our goal is not to be denying these applications. Our goal is to try to help get them across the goal line. In some instances, that's not possible. More often than not, it's not possible because we can't get the employer to communicate with us to correct the deficiencies. So if you could encourage them, we're not bad people. The folks who review these are really great people, actually, and really kind and very customer service focused. So please communicate with us, and which can be done through the portal, can call the call center if they have questions, and we'll connect. So now I want to give you a high level overview of the review process. I promise you there aren't too many more slides left, but this is some pretty key information. First, before I go through this slide, I just want to commend the paid family medical leave staff that I have the privilege of leading for the incredible work they have done to review and approve since April 1st, over 1,600 private plan applications. That's a relatively short window of time. And so how do they go about doing this amazing work that they do? Here's the basic process. An application is received through the portal. It gets assigned to a reviewer, and they take a look at it and figure out, are there any deficiencies? If there are simple issues like the benefit begin dates don't match, or we're missing the FEIN, the reviewer may call the employer directly, or they might send a message through the portal just asking them to confirm some of that information. Any other deficiencies other than benefit begin dates and FEIN, they're going to receive that letter that I mentioned, and the letter will request additional information, or it may, particularly on the self-insured side, say you need to correct this, and this, change this in your plan document, confirm the bond amount. There's 10 business days to correct those deficiencies. There could be follow-up, so the employer could correct the deficiencies. Again, especially on the self-insured plan, we may need to follow up and say, yep, you corrected these things, but we still need you to correct why. A failure to correct deficiencies within the set time frame could result in a decision being made on the application based solely on the information that was filed. And if what was filed has deficiencies, there's a chance that that application could be denied. The general time frame, our average time to approve a fully insured plan is 5 days. It can be less than that if the application comes through and there are no deficiencies. The average time to deny an application is 32 days. On the self-insured side, because it's a more detailed analysis and review, the average time to approve an application is 23 days. And again, the average time to deny is 32 days. That length of time to deny is because we're trying to do some back and forth with the employer to get to a point where we feel like we can approve it and not deny the application. So there is a lot of customer service and back and forth that occurs during that period of time. So what if a plan is approved in the portal and through mail? The employer is going to get a letter, a notification of approval. That notification, the employer should review very carefully and keep handy. It includes the date that the exemption from premium obligations begins. I'm going to show you a slide about how that date's determined in a minute. It will notify them that their administrative fee is now due. The self-insured notification will certify that the private plan is eligible for use because it's substantially equivalent. It will include the effective date and end date of the approval. Remember, approved plans are good for 3 years. Employers will be notified that they can renew the plan when we get closer to that 3-year end period. It will note the ongoing obligations and remind employers that it only exempts them from paying premium contributions to the state fund. They still have to submit quarterly wage reports on time and with detail. They still have to submit an annual claims data report. They still have to comply with all the terms and conditions of the approved plan, the laws, and the rules and policies. And remember, please, if the employer does not comply with all requirements, or if they have a PFML insurance policy that's canceled by the insurer for non-payment of premium, for example, the private plan can be revoked, and the employer would be precluded from applying for a new private plan for a period of 3 years. What if the application is denied? Again, the employer would get a notification of denial. That letter would be in their portal. It will also be sent out through regular mail. They will see it much more quickly in the portal. So I would encourage them to take a look at that. The notification will include the reason for the denial and explain what the employer's rights to appeal are. Employers would have 15 business days to file an appeal. And that there's information on our website on how they go about filing an appeal. Our preference is they do it through the portal. There are step-by-step instructions on our website under the appeals tab. If they don't want to do it through the portal for some reason, they can complete, there's a fillable PDF notice of request to appeal on our website that they can email, fax, or send through regular mail. Keep in mind that during an appeal, none of the employer's obligations change. So while an appeal is pending, the employer still has the obligation to make premium contributions to the state. So there can be, we have seen some confusion about when a premium exemption becomes effective. And so I prepared this slide that shows you the dates by quarter. The tricky part can be if an application is filed the third month of a quarter, the exemption begins the first day of the next quarter. So if we look at quarter 3, for example, if I filed an application for a private plan in September and it's approved in September, the effective date of the premium exemption is going to be October 1st. Here's the other tricky part. If an application is filed in month 1 or month 2, so in July or August for this quarter, but it's not approved until September 1st or after, the premium exemption effective date will be October 1st. That is why it is so critical that employers are looking in the portal. They are responding to any request for changes, requests for additional information as quickly as possible so that we can make sure that applications that are filed in the first or second month of a quarter are approved before the end of that second month so that they can get the benefit for Q3. They get the benefit of a premium exemption effective date of July 1 instead of October 1. So what about changes? If I want to change my private plan or I decide, oh, I don't want a private plan after all, how does that work? Any material change to a plan, the employer has to notify the department and they have to receive approval from the department. So they have to notify the department at least 60 days in advance of the effective date of the proposed change, and they have to receive written approval from the department. A material change is really any change that could affect the rights or benefits or protections for employees under the PFML law and rule. And you'll see some things that I've included here, things like changing the terms of a approved private plan document if it's self-insured, changing a plan from a self-insured plan to a fully insured plan, switching insurance carriers, changes to benefit begin date if it's before May 1st, 2026. What would happen is the employer would submit a new application and we would go through the same review process, the same fees would apply. The only difference in the process is if the change is to the terms of an existing insurance policy or the terms in an existing private plan document, the 3-year term for the private plan will not start all over again. Any other change, if you switch carriers, if you are switching from self-insured to fully insured, a new 3-year window will start. So, in terms of canceling, or some employers think of it as withdrawing their approved private plan, this also requires prior approval. This request is made through the portal. It has to be, the employer is going to have to provide information as to why continuing with their approved plan would cause a significant direct, business impact. And this is very important. It's also important for the employer to keep in mind that they will not be able to reapply for 3 years. We are making some improvements to the portal around canceling or withdrawing an approved plan. So functionality isn't currently available. If you have an employer who wants to try to cancel their approved plan, please call our call center, and they will get them connected with me, and I'll assist them with that. For ongoing obligations, again, there's that fee. Make sure both the application fee and administrative fee are paid. Quarterly wage reports, it must include all of the employee and wage detail, just as if there was no approved plan. Employers worry that if they include that detail, they're going to get assessed a premium. That is not true. The system knows they have an approved private plan, and they will calculate a $0 premium. The annual claims data reports, once benefits begin, these reports become due. So if benefits under an employer's plan began before May 1st, 2026, the first annual report is due July 31st, 2026. If benefits under an employer's plan begin May 1st, 2026, the first annual report is due July 31st, 2027. Final thoughts, just encourage you and any employers you work with to sign up for notifications from our program. If you haven't already, you'll get updated FAQs and resources as they go along. I see a question: if an employer changes carriers, is their private plan immediately terminated when they note the material change, or is there some transition period? Employers may change carriers but don't want to move back to the state plan while switching from one carrier to another. The employer, before changing carriers, must notify the department 60 days before changing carriers, and they need to get approval from the department. The approval from the department will set the date that the current private plan is no longer effective. So when they notify the department that they're going to be changing carriers, they would do that through that application process. Their private plan will be terminated upon approval of that request to cancel. My last slide, I'm sorry, I meant to leave much more time for questions, but I did answer questions along the way. I'm gonna check in. Sophia, did you have other questions that came up? Okay. So if anyone has other questions, you can, at this point, raise your hand or add something to the chat. Here's our contact information. For appeal questions, we have a dedicated email box for that. You can always call that 207-621-5024 number. And if you tell them it's about private plans and you'd like to get connected with Judy Shaw, they will get a message to me and I will call you back as quickly as possible.
And this will be recorded and posted on our webpage.
Yes, so as Sophia is reminding everybody, this will be recorded and posted on our webpage, and the slide deck will be up as well. If you have a question later that didn't come up during the webinar, just call that call center number and ask if they could help get connected to me, and I'm happy to answer your questions.
Thank you.
Thanks, everybody.